Common pigeon diseases and their treatment. Understanding and treating common pigeon diseases. Pigeons are fascinating birds known for their remarkable flying abilities and unique characteristics. However, like any other living creatures, pigeons are susceptible to various diseases that can impact their health and well-being. As responsible pigeon owners, it is crucial to be aware of the most common pigeon diseases and their treatments to ensure the longevity and vitality of our feathered friends. In this article, we will explore some prevalent pigeon diseases and provide insights into their symptoms, prevention, and available treatments. Canker, dealing with trichomoniasis. One of the most prevalent diseases among racing pigeons is canker, also known as trichomoniasis. While canker is a common ailment in pigeons, mature birds often do not exhibit symptoms. However, stress can trigger the growth of trichomonads, resulting in canker and negatively affecting the pigeon's health. Recognizing the signs of canker, such as ruffled feathers, weight loss, loss of appetite, increased water intake, and reluctance to fly, is crucial for early intervention. Canker is highly contagious and can easily spread among pigeons, especially during transportation when they share water sources. Treatment involves the use of medications like ronidazole, Cankerix, Tricho Plus, 4-in-1 Medpit, and local medicine. Timely treatment and implementing measures to reduce stress can help control canker and minimize its impact on pigeon health. Paramixavirus, preventing contagious infections. Paramixavirus, also known as PMV1, is a highly contagious viral infection specific to pigeons. This virus spreads through direct or indirect contact with infected birds, contaminated feed, water, or litter. Infection with paramixavirus can lead to symptoms such as loose droppings, lack of appetite, ruffled feathers, poor coordination, and paralysis. Vaccination is crucial in preventing paramixavirus infections in pigeons. The main biological oil adjuvant PMV1 vaccine has been found to be effective against this virus. It is important to note that the La Sota vaccine, commonly used for Newcastle disease, is not effective against paramixavirus. Implementing strict biosecurity practices, vaccinating pigeons, and limiting contact with wild birds are essential preventive measures to minimize the risk of paramixavirus outbreaks. Respiratory infections, battling bacterial diseases. Respiratory infections, such as mycoplasmosis, catarrh, and ornithosis, are bacterial diseases that affect the upper respiratory tract of pigeons. These infections can cause symptoms such as mucus in the throat, open beak, heavy breathing, watery discharge from the eyes, and respiratory problems. Preventing and controlling respiratory infections require proper loft ventilation, controlling dust and ammonia levels, and avoiding overcrowding and dampness. Several medications can be used to treat respiratory infections in pigeons, including Betracin Gold, Galamycin, Doxy-Ty, mucus powder, and local medicine. By implementing preventive measures and timely treatment, pigeon owners can minimize the impact of respiratory infections and maintain the overall health of their flock. Coccidiosis, tackling an infectious intestinal disease. Coccidiosis is a highly infectious disease caused by a protozoan that infects the intestines of pigeons. Young pigeons and those exposed to stress are most susceptible to this disease. Recognizing the symptoms of coccidiosis, such as loss of appetite, puffiness, lethargy, watery droppings, and weight loss, is crucial for early intervention. Preventing coccidiosis involves maintaining a dry and sanitary loft, avoiding contact with contaminated water and droppings, and isolating new birds. Medications like Sulmit, Belmit, Noxil, 4-in-1 Medpit, and local medicine can be used for treatment. By implementing preventive measures and promptly addressing coccidiosis, pigeon owners can ensure the well-being of their flock. E-Coli, addressing a common bacterial infection. E. coli, also known as colobacillosis, is a prevalent bacterial infection in pigeons. It spreads through infected dust particles, rodent droppings, and contact with infected pigeon droppings. Symptoms of E. coli infections can vary depending on the affected body part and may include weight loss, loose and mucousy droppings, and respiratory problems. Preventing E. coli infections involves maintaining good loft hygiene, keeping rodents away from feed and water, and controlling dust and ammonia levels. Medications such as Amoxicillin, 4-in-1 Medpit, Feraltidone 20%, and local medicine can be used for treatment. By implementing proper hygiene practices and minimizing the risk of bacterial infections, pigeon owners can protect their birds from the detrimental effects of E. coli. Adenovirus infections, understanding different types. Adenovirus infections in pigeons can be classified into two types: adenovirosis I, classical adenovirosis, and adenovirosis II, necrotizing hepatitis. Adenovirosis I primarily affects young pigeons, while adenovirosis II can also occur in older pigeons, leading to significant mortality. These infections have become major concerns within pigeon populations worldwide, requiring a deeper understanding of their causes, symptoms, and preventive measures. Adenovirosis I is often introduced into a loft through contact with infected pigeons or contaminated travel baskets. The virus damages the intestinal wall, allowing harmful bacteria to proliferate and enter the bloodstream. Typical symptoms include sudden onset vomiting, diarrhea, general weakness, and rapid spread of infection among the young birds. Treating secondary infections promptly is crucial for effective recovery. Adenovirosis II is a more severe form of the disease that affects both young and old pigeons. It causes massive liver necrosis, leading to rapid death in affected birds. Symptoms include vomiting, yellow diarrhea, and a high mortality rate. Pigeons that survive adenovirosis II develop immunity and do not exhibit symptoms upon re-exposure to the virus. Currently, there are no efficient treatments or vaccinations available for either form of adenovirosis. Preventive measures, such as maintaining hygiene, proper ventilation, and avoiding overcrowding, are crucial for minimizing the risk of infection. One-eyed colds, managing eye infections. One-eyed colds in pigeons are typically associated with physical injuries or pecks to the eye. Although they can resemble the early stages of mycoplasmosis, these infections are localized to the eye area. The most common symptom is the presence of watery or mucousy discharge in one or both eyes, with severe cases resulting in the complete closure of the infected eye. Preventing one-eyed colds involves maintaining proper loft ventilation, avoiding overcrowding, and minimizing dust levels in the loft. In the case of infection, medications such as Forma drops or Lisicur eye drops can be used for local treatment. By implementing preventive measures and timely treatment, pigeon owners can help their birds recover from one-eyed colds and prevent further complications. Paratyphoid, salmonellosis, combating a widespread disease. Paratyphoid, also known as salmonellosis, is a widespread disease caused by a gram-negative bacterium. It can enter a loft through infected pigeons, rodents, contaminated dust, footwear, roaches, or contact with wild pigeons. Symptoms of paratyphoid vary but commonly include rapid weight loss, loose greenish droppings, swelling in the leg joints or feet, wing boils, and respiratory issues. Baby pigeons may die in the nest or exhibit labored breathing. Preventing paratyphoid requires maintaining loft hygiene, regular cleaning and disinfection, minimizing contact with potential carriers, and maintaining an acidic pH level in the loft. Vaccination and medications such as Therapreme, Doxycycline, and local treatments are available for treatment. By implementing these preventive measures and seeking appropriate treatment, pigeon owners can protect their birds from the detrimental effects of paratyphoid. Pigeon pox, understanding and preventing a viral infection. Pigeon pox is caused by a virus commonly carried by mosquitoes and other biting insects. When a non-resistant pigeon is bitten by an infected insect, the virus enters the bird's bloodstream. Within 5 to 7 days, small whitish wart-like lesions appear on the head, feet, legs, and beak areas. Over time, these lesions can grow into large yellowish bumps, but it is important not to remove them, as they will eventually dry and fall off. Preventing pigeon pox involves regular vaccination and controlling mosquito and fly populations around the loft. By implementing these preventive measures, pigeon owners can minimize the risk of their birds contracting pigeon pox. In case of infection, vaccines and local medications are available for treatment. Pigeon malaria, addressing a protozoan infection. Pigeon malaria is caused by a protozoan that attacks the red blood cells of pigeons. It is primarily transmitted by pigeon flies, which act as the immediate host. Symptoms of pigeon malaria are often vague, including loss of gloss in plumage and reduced performance in racing events. Preventing pigeon malaria involves controlling pigeon flies, as they are the primary carriers of the disease. Quarantining newly acquired birds, dusting or dipping birds after contact with others, and avoiding contact with wild pigeons are essential preventive measures. While curing this disease is challenging, medications such as Austraila water-soluble tablets and Ava's malaria powder, as well as local treatments, can be used for treatment. By implementing preventive measures and seeking appropriate treatment, pigeon owners can protect their birds from the detrimental effects of pigeon malaria. Sour crop, addressing fungal infections in the digestive tract. Sour crop, also known as candida or thrush, is a common disease caused by a fungal infection in the digestive tract. It is often associated with the excessive use of antibiotics. Symptoms of sour crop include listlessness, loss of appetite, weight loss, a water-filled crop, frequent vomiting, and putrid-smelling vomit. Preventing sour crop involves maintaining proper loft hygiene, avoiding overcrowding, and using antibiotics judiciously. Medications like Digestol, Probios, HealthGuard, and local probiotics can be used for treatment. By implementing these preventive measures and seeking appropriate treatment, pigeon owners can help their birds recover from sour crop and prevent further complications. Worm diseases, understanding and preventing infestations. The most common types of worms found in pigeons include roundworms, hairworms, stomach wall worms, gapeworms, strongylids, and tapeworms. Symptoms of worm infestations vary but can include droopiness, weight loss, and diarrhea. Gapeworms can cause breathing problems. Preventing worm infestations involves regular cleaning and maintaining a sanitary loft. Implementing a preventative worming program using medications such as Vermex, ivermectin, and local treatments can help control and treat worm infestations. Additionally, practicing good hygiene and minimizing contact with potential carriers are important preventive measures. Conclusion: being aware of the most common pigeon diseases and their treatments is crucial for the well-being of your flock. By implementing preventive measures, maintaining proper loft hygiene, and seeking appropriate treatment when necessary, you can minimize the risk and impact of diseases on your pigeon's health. Regular veterinary care and consultations are recommended to ensure the best care for your pigeons. There are many reasons to buy my racing pigeon method. Here are some of the best reasons. You will get excellent results. It's a very simple system to use. It's affordable. I have had over 400 first prize winners. It's adaptable to any situation. You can use it with any racing method, natural, widowhood, young birds. It's a very effective method. There is no need to spend a lot of money on fancy pigeon products. It's a reliable system and it is foolproof to use. Professional athletes, race horses, take the same products. There is science behind this, not just hearsay. It is all to do with red blood cells and oxygen in the blood. Without that, a pigeon will not race well, or an athlete will not win a race, if he has low oxygen in his blood. The above is fact and is 100% science. There are a few things you can do to improve your chances of winning at racing pigeons. One of the most important things is to learn as much as you can about the sport. You'll need to know the different types of pigeons, how to train them, and how to race them. Another key factor is practice. You'll need to be able to fly your pigeons competently in order to win races. And, of course, you'll need to have the funds to invest in racing pigeons and other racing equipment.